Welcome to Biotouch Permanent Makeup and Guide to Eyeliner Procedures Step by Step. Eyeliner procedures are in high demand. They can enhance, beautify, and energize the look of the eyes. We use a pendulum technique on both the top and bottom lid. Eyeliner can be thick or thin, with or without tails, and add emphasis and definition to the eyes and lashes. Set up the workstation within close reach. Prepare and sanitize the area thoroughly. Assemble the machine, pigment selection, and supplies. Position the client comfortably. After wiping the area clean with microbial cleanser, remove any remaining makeup or mascara, making sure that the area is dry. Have the client close and relax their eyes. Use your fingers to open the lid to place a few drops of Celluvisc for protection. This barrier helps in case pigment or anesthetics gets into the eyes. Blot any excess, making sure the lash root is completely dried and prepared for anesthetics. Now, apply instant numb anesthetic to the lower lash root area. Hold the eye open firmly with your fingers. If you release your fingers too soon, anesthetic may get into the eyes, or it may burn and cause irritation. Eyes should remain open for the entire 1 to 3 minutes while the anesthetic takes effect. Some clients may want to flinch or blink, but you will still need to hold the lid open tightly. When time is up, before releasing your fingers, dry the area completely so that any remaining anesthetic is wiped away. There should be no anesthetic present. Always use a pencil first to draw your guideline and to allow for any adjustments. Follow the lash root line, removing any excess. To ensure the guideline won't smudge during the procedure, go over it with semi-permanent liquid color. This, too, should be kept right up against the lash root over your penciled line. Begin the procedure with the lower liner, starting at the center of the lower lash root line. Hold the machine at a 90-degree angle, pointing upward and toward the center. If you hold the machine downward, it may cause migration out to the lower eyelid. As a way to check if you have the right angle, look at your needle cap. It should be in a horizontal position. In this procedure, we used a 3-prong flat needle. Notice how important the finger placement is here for your technique to be smooth and stable. The technician here has her whole finger placed horizontally across and just beneath the lower lash root area. If you apply too much pressure, the lower lid can roll down, or if the corners are pulled unevenly or pinched, it will alter the shape and direction of the liner. As you get closer to the inner corner, feather and fade your line into the lash root. Be cautious and careful around the corner areas as they are easy to bruise, and stay away from the tear duct. When you stay focused on a slow, steady speed, you are able to clearly check your work for complete coverage. Another very important reminder is that you want to really get a feel for the vibration in your fingers, as the needle tip is making contact with the skin. If you don't feel enough vibration, you may not be depositing the pigment deep enough. Don't try to go too fast. Trying to speed up can cause unnecessary irritation or scarring. You can go over the line lighter at first, but your back and forth motion, along with proper depth, will give you the darkest and most desirable results for better retention. Only the color deposited into the dermis layer will remain permanent. What is seen is the muted color showing through from underneath the skin and natural looking. Now we will begin the upper eyeliner. With the client's eyes still closed, use your fingers to hold the eyes open so that you can apply the instant numb anesthetic for at least 1 to 3 minutes. Remember to dry completely before releasing your hold. Before you begin the procedure with the machine, take a moment to analyze the upper lid and get a close look at how thick or thin the skin is. Be aware, if you can see the small vessels easily, that means there may be a tendency to bruise or bleed more, so adjust your machine speed and length of the needle accordingly. In this case, you will want to control the depth as well. Begin the upper eyeliner procedure starting at the center of the upper lash root line. If you hold the machine upward, pigment will shoot into the blood vessel and travel out, causing migration to the upper lid. Begin at the center of the lash root line. Go over the entire eyelid back and forth at an even speed. Each motion will be connecting and smoothing, then connecting and smoothing, and feathering off to the tail. Come back now to the center point and repeat the smoothing and connecting. Repeat the smoothing and connecting. Tapering and blending the end into the lash root. As a final check, wipe the lid dry and look for any spaces in between. Now you can touch up and connect them by filling in and blending into a smooth line. As you can see, there's little or no swelling or bleeding. Now let's take a look. This is the beautiful upper and lower liner immediately after. The Biotouch state-of-the-art pain control system, along with superb machines and quality pigment, all together work hand in hand for beautiful results. Thank you for joining us in the presentation of this eyeliner procedure. From color theory, pigment retention, and procedures, to camouflage and corrections, Biotouch offers a complete library and online resource for permanent makeup. If you are interested in learning how to do brow and lip liner procedures, online training videos and hands-on classes are available. For more information, please visit our website at www.biotouch.com.